you would notice that the number of cancer patients in the community are increasing. We all know somebody who has cancer. What do we do to protect ourselves from having a cancer? Now, this is a question which I get asked very regularly in the clinic. Doctor, my relative has a cancer. What can I do to protect myself from getting that cancer? I would like to give 5 tips for preventing cancer. These tips are for reducing the chances of you developing cancer. That does not mean that you will not develop cancer, but at least we will be able to reduce the chance that you will develop cancer. The first one and the most important is diet. We need to watch what we eat. There are cancers which are specifically linked to our diet. So for example, if you are eating a lot of fatty food, then there is an increased chance of you developing maybe breast cancer or intestinal cancer or liver cancers. So a diet which is healthy and rich in minerals and vitamins is very important. If you look at our Indian diet, what we call as a square diet is excellent. We have a good balance of carbohydrates, proteins, fats and all the trace elements. So good diet, maybe home cooked diet, is an excellent way of keeping yourself healthy. And not having anything in excess, so not having too much of fried food, not having too much of sweet food, again is very important. So a good, healthy, balanced diet. That needs to be mapped with exercise. Our life has become so busy, especially if you're living in a city, we are all running around all the time. Life is very busy and we have no time for exercise, which is a big problem. Exercise is extremely important in keeping yourself healthy, keeping your body and your immunity very healthy and preventing cancer. So there are many cancers where we know that patients who continue to exercise, the chance of their relapse or actually developing the cancer is less. So exercise is an important way of reducing the risk of you developing cancer. The third is addictions. Many of us are now addicted to various elements, whether it is alcohol, whether it is tobacco, and in some cases even drugs. All of this take a toll on our health and they significantly increase the chance of developing cancer. If you take, for example, tobacco. Tobacco is a poison which is like nothing else. Patients develop cancers of the oral cavity, throat, food pipe, breast, urinary bladder, liver. All sorts of cancers come because of tobacco. Same is alcohol. Alcohol increases the chance of developing multiple cancers, and if you are combining alcohol with tobacco, it is a very, very poisonous material and will cause many cancers or increase the chance of developing many cancers. So these must be avoided, and also drugs must be avoided. That will significantly reduce the risk of developing cancers. The fourth is knowing your own family history, and this is very important. There are certain cancers which are familial cancers. For example, around 10% of women will have inherited breast cancer. So their mother would have it, their masi would have it, their grandmother would have it, or somebody else would have it in the family. Colon cancers can also be like that, and some other cancers. So it is important to know your family history. If there is a family history of cancers, you need to be more proactive and you need to get screened, you need to go to the doctor early and get your regular checkups done. So knowing your own risk, for example, if you are a smoker, you need to get your lungs checked regularly. If you are a tobacco chewer, you need to get your mouth checked regularly. So knowing your own risk of cancer is an important aspect of preventing cancer. And the fifth is regular health checks. The kind of life that we lead right now, which is very busy and stressful, it is important that we do regular health checks to completely screen the body and identify if there are any risk factors for developing cancers or if there are any early signs. So for example, in women, we recommend that we do mammography after a certain age to see if there are any precancerous lesions. Or we do pap smear in women to check for any cervical cancer being developed. In older men, we recommend we do serum PSA to check if the patient is at a higher risk or has developed prostate cancer. So all of this will become part of your regular health check, and that is an important part of preventing cancers. So 5 effective ways of preventing or reducing the chances of you developing cancer would be a good diet, a regular exercise program, getting rid of all the addictions, knowing your own history of chance of developing cancer, and fifth is regular screening and checkups.